Good evening. Welcome to the COVID-19 Vaccine Virtual Forum. We thank everyone at home for taking time to tune in. I'm Sandra Clements, former City Council person and the moderator for this event. We know that COVID-19 has disproportionately impacted persons of color and service workers. Now we have several vaccines offered to the public to stop the spread of this virus. There are still many questions and concerns about the virus and the vaccines. We hope to answer some of these questions and give everyone more information about the vaccines. Over the past few weeks, people have been given the opportunity to submit questions for the panel, and for any viewers if there are any viewers who still have questions, you are welcome to submit those questions. You can do it either by calling 304-962-8138, 304-962-8138, or emailing vaccine@huntingtonwestvirginia.gov, and we will try to answer as many of these questions as we possibly can. I want to introduce the man who needs no introduction, the first three-term mayor of the city of Huntington, Mayor Steve Williams.
Thank you, Sandra. And it's good to see you back in City Council chambers. We miss you, but you had big shoes to fill, and they have been filled. And I'll introduce one of your replacements here in a moment. Thank you for being here. Thank you for each of you agreeing to participate in this, because our community needs to hear facts, to hear about the science, and then they can have a choice as to whether or not this is something that will resonate with them, and they can make an educated choice as to whether or not a vaccine is for them, and they can also make a choice as to what's right for their family and for those who they love, who they're going to be interacting with. We'd like to thank the partnering agencies of this forum who have organized this forum for the city of Huntington. The agencies include the Marshall School of Pharmacy, the Fairfield Community Development Corporation, and the Dr. Carter G. Woodson Lyceum at Marshall. This is the second virtual forum that I've participated in about the COVID-19 vaccine in an effort to educate our community about why it's important and also safe. I was eager to host this forum after my office was approached by Bernice Morris of the Woodson Lyceum and Dr. Clay. Also, I'm happy to see involvement from the Fairfield community through our esteemed District 5 Councilwoman Teresa Johnson, as well as her predecessor, Sandra Clements, who will serve as the moderator this evening. While this evening's forum will provide critical information to the general public that is based on science and data, we intentionally want to promote this forum to the Fairfield community because of some alarming data that the medical community has seen across the country. COVID-19 has disproportionately impacted racial minorities in the United States. According to the Centers for Disease Control, blacks represent 12.7% of the U.S. population, but have accounted for 23.4% of the COVID-19 related deaths when standardized for age. CDC statistics also indicate that approximately 30% of blacks say they are definitely willing to receive the COVID-19 vaccine, compared to 55.5% of whites. Let me speak just very personally. I am proud that I was able to get the vaccine. My wife and I got 2 shots of the Pfizer vaccine, but I also have to admit, last fall, when there was a lot of conversation about the vaccine being rushed and pushed through, I was wondering, do I want to be one of the first ones? Maybe I just want to see some others go through and then see what happened. And then if there's not a problem, then maybe I'll get in line. I had an opportunity to be first in line. There were some that came to me and said, Mayor, you go in and be first and have this up front in public. I didn't do that, not because I was fearful of the virus or fearful of the vaccine. I didn't do it because I didn't want to be accused of jumping line. I said, when those around me are getting a vaccine, I'll go. And I will encourage anybody and everybody to do it because the science points to that it will protect you. And now we're in March, and it was in early February. I had the opportunity to have the shot and the second shot, and I'm proud to report that I had no problems whatsoever. I have a 90-year-old mother who is living in a personal care facility here in Huntington. We know how hard this last year has been. Was never able to go in to see Mom. After a while, they arranged for visits where we would have to mask up, sit distantly, and never be able to hug my mom. Early on, I was go outside her room and see her crying at the window, reaching out. The beauty is, Mom got her vaccines. My wife has her vaccines because she is a frontline worker in a doctor's office. Guess what I've been able to do? Not just to see her, but go up to her apartment and sit down with her and have a hug. I'll walk in with a mask, but when I'm in there, we don't have to. So what I'm simply suggesting to anybody who's listening right now, give some thought to this. Do it for your health. Do it for your safety. But do it also for those who you love. This is an opportunity for us to find our way back to normal. And the reason that we have these doctors here speaking with us today is that they have the facts. They understand the science. If we can't trust them, then who are we going to trust? I'm sure not going to trust, well, I don't have it with me. I'm not going to trust my phone. That's not going to give me the facts. These folks are. And we have a wonderful partnership here in Huntington, with the administration, but we have a city council that represents our residents, and they are our city legislature. Representing District 5 is Teresa Johnson, brand new to City Council, but she brings a wealth of history and experience within the Fairfield community. She reminds me of someone who I used to serve with when I was alongside City Council, because one thing I found about her, if you're going to ask her a question, you better be braced to hear really what she thinks. So it's my pleasure to introduce to you and bring to the podium the councilwoman representing the District 5 of the City of Huntington, which includes the Fairfield neighborhood, Councilwoman Teresa Johnson.
Thank you, Mayor. My name is Teresa Johnson. I am the representative for the Fairfield District 5 community. as the mayor has already spoken and have thanked everyone, I am like the mayor. I'm going to speak from my heart. For the last year, I have watched families be destroyed. I have watched children lose their mothers, mothers lose their children and their fathers. And I was just like the mayor and probably many of you. I wasn't sure whether I was going to take the vaccine or not. But I had to think about something. I've been praying for an answer for the last year. I've been praying that the Lord would give us something, give us some answer, give us a vaccine. And so when something came, then I'm going to doubt that this is real or not. So I had to kind of look at myself and wonder, am I really believing what I'm praying for? I had to think on that. Fairfield has been just really partly destroyed. We have had funeral after funeral after funeral. As the mayor have already stated, I have an 85-year-old father myself. I have not been able to go to Columbus to see him. I mean, and it really breaks your heart, because we know that every day when they're in their 80s is you pray that your phone don't ring, that your father or your mother haven't died of the virus. So I am grateful. I'm grateful that I have this opportunity to share with you how I really feel, and to even have this opportunity to say, thank you, Lord, for a vaccine, something that we can really get and be healthy, and that we don't pass it down to someone else. My fear was that I would give it to someone. They tease me at Kroger's and say I go in Kroger's like a thief in the night. You know, I'm in real quick and I'm out. And it's just sad that we are at this place. But you know, I was thinking about it. I'm in my 60s. I remember the flu vaccine, the measles, the chicken pox. I can go on and on. And I didn't have those kind of things going on in my mind like I did this. But I am grateful. I'm grateful for this opportunity to represent Fairfield, District 5. I love the people. I have been working in the community for 40 years. And I'm glad to be here to represent. And I want you to get on the phone, call somebody, text somebody that has been asking you questions about this vaccine, and give them the opportunity to get it from the real people, the people that really know. Thank you.
Thank you, Mayor. Thank you, Councilwoman Johnson. Let me remind you that if you have questions, you can call 304-962-8138. The gentleman's there waiting to take your questions. Or you can email vaccine@huntingtonwv.gov. All right. So we have with us this evening for our panel 4 panelists who will introduce themselves and tell you how they have been, what they've been doing during the pandemic and during the administration of the vaccines. So let's start with Dr. Tyler Clay.
Thank you. My name is Tyler Clay. I am a clinical assistant professor at Marshall University School of Pharmacy, where I teach our infectious disease therapeutics course. I'm also employed at St. Mary's Medical Center, where I'm a clinical pharmacy specialist and have been working with our physicians and our COVID units since the start of the pandemic to help optimize medication therapy for our patients that have been admitted to the hospital.
Next, we'll move to Dr. Cara Orwig.
Hello, and I'm really excited to be here this evening to help ease any of the fears or answer any of the questions that may still exist about the COVID vaccine. I think all of us on this panel believe that vaccination really is our best tool to protect the members of our community. And so we're really eager to share with you why we are so excited about it. My name is Cara Orwig. I am the clinical pharmacy and specialist in infectious diseases, it's a mouthful, at St. Mary's Medical Center, where I've been practicing for the last 17 years. So as someone in infectious diseases, COVID has occupied most of my headspace for the last year. where I have been involved in the management of treatment of patients who have been admitted to St. Mary's Medical Center with COVID infections. And I was the co-coordinator of the COVID vaccine clinic, where we vaccinated all of the St. Mary's and HIMG employees and gave over 5,000 doses.
Wonderful. We'll move on to Dr. Charles Babcock.
Thank you. I'm C.K. Babcock. I'm with the School of Pharmacy. Like Dr. Orwig, I've been involved in a lot of clinics, both with the health department, several other health departments as well. If there's somebody giving vaccines and they need help, I love to be part of it. I'm very good friends with Dr. Krista Capehart, who managed the state's vaccines and has done such a great job getting them out to everybody. And I cannot sing her praises enough. She happens to be a very good friend of mine. I got tickled hearing Mayor Williams talk about how he felt bad about getting a vaccine early. My good friend called me with her first clinic, and she said, I need somebody to help run it. Can you come up and give you shots? And so I brought a couple of students, and I felt bad because we got shots before Christmas. Our first ones were before Christmas, and our second ones were before the end of January. And my sister yelled at me for 2 months before I could get my mother a vaccine. I don't lie about that. She said, here you are, you're working all these clinics, and I was working all these clinics, giving shots all over the place. I am glad to show up. I'll do anything at a shot clinic. I also teach vaccines for the School of Pharmacy. I teach pharmacists how to do it. It's what I do. I love immunizations. I've been directing immunizations since early 2000s when I started running clinics when pharmacists weren't allowed, and we used to have to hire nurses to come into buildings to do them. I love immunizations. I love everything about them. I love the history. I love what they do, and I'm a firm believer in what my mom always told me, and that's an ounce of prevention is worth a pound of cure.
All right.
Thank you.
We'll move on to our last panelist. We saved the best for last.
Thank you, Sandra.
Dr. Cynthia Jones.
So my name is Cynthia Jones, and my training is actually in the pharmaceutical sciences, and my area of expertise is pharmaceutics. And so what we do is study the physical and chemical properties of medications. We take that information and then we develop various dosage formulations. We use the FDA guidelines to adhere to whatever they tell us to do to develop those dosage forms. Now, as a professor at the School of Pharmacy here at Marshall, it's my responsibility to take what I know and teach our future pharmacists about the basic foundational sciences and the principles behind formulating these various medications. And some of those dosage forms you're all familiar with. They're your tablets, your capsules, suppositories, lotions, your suspensions, even those syrups that you see at your community pharmacy. That's what we do. And so our students learn the principles behind getting those formulated, and more importantly, they learn how to safely administer all of these medications to patients. And so it's an honor to be here tonight to just share my area of expertise with the community and dispel some of these myths that are out here. I'm really happy to be here.
Thank you, Dr. Jones. I want to remind you that the phone lines are still open. Brian's over there not doing anything, so please call 304-962-8138. So we're ready for our questions. And so the first one goes to Dr. Babcock. Can you address the importance of the vaccine and what it means for getting herd immunity?
I am so glad you asked that question first. Herd immunity goes back to exactly what we've all been talking about here. We've been talking about immunizing one person to protect others. And that's really what vaccines do. You get a vaccine not just for yourself, you get a vaccine to protect your friends. You get a vaccine to protect your family. And I know right now we're very divided at times, but one thing about it, you're even getting vaccines to protect people you don't like. I mean, literally, your vaccine protects everybody. And that's really what we got to focus on. How do we make the world a better place? I wanted to talk a little bit about herd immunity, so I started breaking down some numbers today, and Dr. Orwig may disagree with some numbers I use, but I'm going to round off some numbers. I looked at Johnson & Johnson. I used 70% for their efficacy rate rather than 67 or 75 because I know it varies. But what I wanted to look at was I ran a couple of statistical analyses, and what I looked at it is if you use Johnson & Johnson, we have to vaccinate 70% of all of our people in order to actually achieve herd immunity. So we're going to have to vaccinate 7 out of 10 people. I don't know about you guys, but if I talk to any 10 people, there's more than 3 that are hesitant to take this stuff. I am so glad we're here tonight. Thank you guys for having us, because I address this all the time at our clinics and talk to all kinds of people who are hesitant. And I've seen more people take this vaccine that were hesitant when they started talking about it than you can imagine. But it's not everybody. But the whole point is we got to get those hesitant people to do it. With J&J, with their numbers, you have to get to 70%. With Moderna and Pfizer, you have to get around 52%. Sorry, I did the math and I brought it with me. You have to get around 52%. So I'm going to say we need to reach at least 60, 65%, somewhere in there, in order to help our people. So I went looking and I thought about it, and I thought, man, well, this creating herd immunity means that just because one person doesn't have the vaccine, they probably won't get the disease. It means, that's what it means. You've got a good chance of not getting it. When I started looking, as of yesterday, only 22.4% of the U.S. population had received 1 dose, had been half vaccinated, and only 12.18% had been fully vaccinated. So I said, we got to get over 60. We're at 12 people. So I want to bring that to light, because we got to get more people vaccinated.
Absolutely.
And we're trying. Believe me, we got clinics everywhere. We got vaccine going out as fast as it can go. And please keep your heads up and look for it and get out there and get it. That's what I'd like to ask everybody to do. The second thing is West Virginia is slightly better. We're at 23.8% have had 1 dose, and 14.7, so almost 15, have had both doses and are fully vaccinated. Oh, I'm sorry. I can move a little closer. I'm sorry. So my point is, if we're going to shoot for 71% and we're at 22, let's just say we got 49% of people that still need vaccinated. We need to vaccinate two more people for every 1 that have had it. So think about it that way. That's what we need to get to. We need to get more and more people vaccinated in order to achieve herd immunity. And I know almost everybody knows what herd immunity is, but really it just means everybody being vaccinated that can get it in order to protect others. And it is a wonderful thing. And like I said, more than 2 people for every 1 who's been vaccinated needs to be vaccinated. So please get out there and get it if you can. Look for it.
Wonderful. Thank you.
Thank you.
We'll move on to question number 2, which goes to Dr. Tyler Clay. How long does the immunity last, Dr. Clay?
That's a great question, and it's a question the community as well as healthcare professionals are dying to know the answer to. But to answer that question, we really have to look at where we're at in this pandemic. It was just over a year ago, March last year, when the individuals in the first phase of the first clinical trial received their very first dose of this vaccine. So there's only a few individuals in the country at this time that have even received their first dose over a year ago. So I think the answer to this question is going to come out in a stepwise approach. Right now, we can say with a great amount of confidence that it's at least 3 months. But that doesn't mean the answer is only 3 months. It means that's what we can say confidently right now based on our data. Hopefully in a few weeks, we're going to be able to confidently say it's 6 months. And then a few weeks after that and months after that, we're going to be able to say it's a year. And we hope to say 2 years, 3 years, and hopefully even longer. But that's an answer that's going to take time. And as of right now, we can say definitively it's at least 3 months. And hopefully in the next few weeks, we'll be able to say definitively it's at least 6 months.
Okay, thank you. Next question goes to Dr. Jones. How was the vaccine developed so quickly? Were any corners cut to get it out faster?
Oh, this is an excellent question. I think a lot of folks were definitely, not wanting to take the vaccine because they felt like it came out so quickly. So I just want to make a few points. So traditionally, in the drug approval process, there's 3 primary phases that a company will go through. You have the research and development phase. And so this is when the company will conceive and actually make a vaccine. If it gets through that phase, then you can get to the preclinical phase. And that's when the vaccine is then tested in animals to look for safety and efficacy, along with some other key data points, like how much of it is going to be needed, so what's the dose for it to be effective. Providing it gets through that process, then it gets to the real nitty-gritty, which is your clinical trial phases. And so any trial that gets to that point is going to be approved by the FDA and also overseen by the FDA. Now, in the case of an extreme emergency, like we see here with the pandemic, we actually have a process that was set into place back in 2004 for situations just like this, and that's the emergency use authorization. And so, although we're using a different process, that's what helps to get it pushed through a lot faster. As far as cutting corners, I wouldn't say cut corners. What I can say is that having this pandemic, we were able to push other things to the side and kind of like skipping the line. So vaccine development became first priority for not only us here in this country, but across the world. So when you push everything else to the side and make that a first priority, now everyone is focused, everyone is knowledgeable, ready to go ahead and start with the clinical trials as early as, like my colleague over here said, last March. No corners were cut. We just made it a priority. And thank God we made it a priority, because now we do have people that are able to be vaccinated and meet with their families.
Thank you, Dr. Jones. All right, Dr. Orwig, let's get you into this mix here.
Okay.
If COVID has less than a 1% mortality rate, why does anybody need to take the vaccine?
Okay, so there are actually a lot of benefits of vaccination that I'm really excited about and reasons why I want to see people get vaccinated. But let's start with the 1% mortality that is mentioned in the question. And I think it's important to understand what that 1% really means. That 1%, it's actually 0.68%, but we'll round up to 1%, is the case fatality rate or the death rate for everyone overall worldwide. But there are groups of people who have higher fatality rates than 1%. So we need to make sure that if you're talking about this 1%, that it really applies to you as an individual. So the most important influencing factor is age. For people who are less than 65 years of age, that case fatality rate really is 1% or lower. For people who are 65 to 74 years of age, it's about 2.5%. For those who are 75 to 84 years of age, it's about 8.5%. And for people who are 85 years or older, though, the case fatality rate jumps to 28%. So we need to think about this. Our loved ones, my grandparents, your parents, what have you, they're not in the 1% category if they're 85 years old. The other influencing factor is race. Black Americans are 2 to 3 times more likely to die from COVID than white Americans. And so that 1% may not apply directly to you. Now, even if it does and you're cool with those odds, there are a number of other reasons to get vaccinated, because death really is just the tip of the iceberg when we're talking about the bad outcomes associated with COVID infection. Hospitalizations far outnumber deaths, and Black Americans are 3 to 4 times more likely to require hospitalization than white Americans. At St. Mary's, when we have a patient admitted with COVID, almost all of those patients are staying for at least 5 days, some for 10 to 14, some even longer. So that's a long, hard, difficult, and probably expensive recovery in the hospital. All of the available vaccines have very high efficacy in preventing death and hospitalization. Okay, as the pandemic continues, we're also starting to learn more about the ways that COVID can injure major organs, like inflammation of the heart tissue, fibrosis of lung tissue, damage to the kidneys. And we don't yet know what those long-term consequences are going to be or how that's going to affect patients in the future. We have another set of patients who develop COVID who don't have any organ injury, but they don't return to their full state of health. So they are having months of night sweats, fatigue, brain fog, altered taste and sense of smell. They can't exercise like they used to before they were diagnosed with COVID. So we call this long COVID or long haul COVID. And some studies have suggested that more than half of people who develop symptoms from COVID still have at least one of those symptoms 3 months after their positive test. So even though only 1% of people are dying, not all of those who are surviving are thriving, okay? The last thing I want to touch on really quickly is something that the mayor was alluding to, is that the vaccine appears to, we're starting to get some clues that vaccination will allow us to move towards a more normal life. Maybe not normal yet, but more normal life. So the CDC is moving slowly and cautiously, as they always do. But in the last week, they released some new guidelines that make some masking and physical distancing exceptions for people who are fully vaccinated. So fully vaccinated means that you have gotten both doses of Moderna or Pfizer, or 1 dose of the J&J vaccine, plus 2 weeks for your full immunity to develop after you receive your vaccines. Fully vaccinated people can now hang out with other fully vaccinated people in small groups indoors without masks and without physical distancing. Fully vaccinated grandparents can hug their grandchildren if that child is not at a high risk for developing severe COVID. And I think one that's not really been pushed out in the media much, but I find really important, is that if a patient has been exposed to someone with suspected or confirmed COVID, they're fully vaccinated and they don't have any symptoms, they don't have to quarantine. So that's no more missed work and vacation days and all those types of things that are making life really difficult in a pandemic situation. So lots of benefits beyond preventing death, and lots of reasons why I'm excited about what the vaccine can do and why I want to see people get it.
Thank you, Dr. Orwig. Let's come back to you, Dr. Babcock. What safety measures are in place surrounding the COVID vaccines?
Well, I'm glad you asked that. Thank you. There's a lot. I love that Dr. Jones did a great job talking about, how this thing came about and how we've been looking at it. And everybody's mentioned it started last March, is really when the vaccine trial started. But I like to also make sure people who are hesitant realize that the vaccine trials really had 30,000 people in them. Each one of these vaccines has been tested on a minimum of 30,000 people. That's a good number to be tested in. That's going to tell you a lot. We have many drugs that are on the market that have never seen 30,000 people. I'll promise you that. We don't have data from it. But the first thing I hope you notice when you go to one of these clinics is you're going to notice that people are asked to stick around for 15 minutes. Now, in a pharmacy, we've been asking people to do this for a flu shot forever, but not everybody does it, and a lot of people will just leave. But everybody's staying at these COVID clinics, and I'm so proud of that and so glad to see it. Because 90% of severe, and I said severe, adverse reactions, so if someone's going to have an allergic response or they're going to need a hospitalization, that happens in the first 15 minutes typically. Okay, so if almost all of our clinics are mandating people do that. We did a drive-through clinic the other day, and we had people wait in their cars for 15 minutes. It was great, and people were wonderful, and they waited just like they were supposed to. But what I'll say is that's been wonderful, but the FDA even went a step further. They said if you've ever had an allergic reaction to anything, if you ever had an allergic reaction to food, to a drug, to another vaccine, to anything out there, we want you to wait 30 minutes just to be sure. So we've been doing that at all of our clinics too, and I've not had a single person talk bad to me. And I'm so proud of West Virginians for that, stepping up and doing the right thing, and that's in every community we've had. Okay, I will lean into the mic. Thank you. The next thing I want to say is this emergency use authorization, this EUA that you keep hearing about, it's fantastic what the FDA did. They did one of the greatest things I've ever seen, and I think we're going to see it with all new drugs in the future. They did a project called vSafe. And if you've gotten a vaccine and you haven't signed up for vSafe, I'm sad about that. We need to get this out. We need to get everybody signed up on vSafe. What vSafe does is it's a really quick little text app. It texts your phone, and it sends you to a website, so as long as you have internet on your phone, you can do it. Literally, if you have had no problems with the vaccine, it'll take you less than a minute to fill it out. If you've had problems, you can take as long as you need. So if you want to type in for 20 seconds, it caused me to have all these problems, you can type it all in there. It doesn't text you for just a day. It texts you every day for a week, then every week for a month, and then about once a month after that. And they're doing this long term to check those long-term adverse events, to see if the vaccine actually has any. Everything that you report in there actually goes, this VSafe app, it's really cool, and it's just a website. It goes immediately to both the CDC and to a place called VAERS, the Vaccine Adverse Event Reporting System. We've had VAERS around since 1990, and its whole point to be used for VAERS is that it finds adverse events early. So they find adverse events early, and then they notify us of them. So some of the adverse events we've already found from this vaccine, which I'm so glad to say, and I reported a couple of these because it was really interesting. We had people get the shot, and it's a shot. They're going to put a needle in your arm. You're going to have a sore arm for a day or two. That should be expected. It's a vaccine. It's also going to trigger your immune response, so it's probably going to make you not feel great for a couple of days. Okay, so you might have a little bit of malaise or what they just say, not feeling good. And so I always say that could have a low-grade fever. But we had this really interesting reaction where the arm completely healed, and then a week later, all of a sudden it broke out red, swollen, and swelled up big. And it didn't really hurt the person much, not much, but we've seen a couple of these break out. And the reason for that is the formulation. The lipophilic, they put some fats in this vaccine, and what they think is sometimes it's getting lodged in there. It takes a little longer to come out. And it'll come out about a week later. It lasts 3 or 4 days, but it's not really a big deal. But it was great to get that out there to let everybody know, because if they didn't know about it, people were freaking out. 1 week after the vaccine, their arm turned red. They go, oh my goodness, what's going on? As we all expect, right? And the great thing is the FDA put this out there, let everybody know, and said, hey guys, don't freak out about it. It usually clears up in 3 days. So that was fantastic. They have changed the question sheet for vaccines several times. The most recent change is for dermal fillers. So if you've had things where you've had dermal fillers, we've had enough reports of dermal fillers having reactions from these vaccines that they wanted to tell people, if you got a dermal filler, you might have a problem. Well, that's fantastic. We're learning things and we're finding more about it, and it's doing a great job updating us as to what to know about it. But I really think we're going to see VSafe with all new drugs in the future, and I hope that we do, something like VSafe. But I like VSafe because V stands for vaccines, and they are safe most of the time. So,
Wonderful,
thank you.
wonderful. Dr. Clay, when will the vaccine be available for kids?
That's a great question, and a question that I'm eager to see the answer to because I have a son myself. So to answer that question, though, you really have to look at the age of the child. So when we talk first about children age 16 and older, we have 3 vaccines currently on the market: Pfizer, Moderna, and Johnson & Johnson. The Pfizer vaccine is already approved for children age 16 and older. So as more vaccine becomes available over the next month to 2 months, we'll see that vaccine available to children that age. The next age group we need to talk about is children between the ages of 12 and 15. Currently, 2 of the vaccine manufacturers, Pfizer and Moderna, have clinical trials underway for these age groups, and we're expected to see those trials wrap up sometime in late June, early July. And from that, we hopefully, assuming everything goes as planned, we'll see an approval for children aged 12 to 15 sometime in the early fall, maybe late fall. The third group we need to talk about is children under the age of 12. And they're a little bit more tricky because they require some reformulation of the vaccine. However, on Tuesday of this week, we had an announcement from Moderna stating that they are beginning clinical trials in children under the age of 12. So when we look at the timeline of this clinical trial and what we've seen from the previous clinical trials, we would expect to see some answers, hopefully, January of 2022, seeing that data come out, and then an approval for children under the age of 12 sometime in the spring of 2022.
Thank you. So we're not talking about babies at all? No. Okay, cool. Dr. Babcock, let's come back to you for a minute. Can someone still receive the COVID vaccine if they have received monoclonal antibody treatment
Yes, ma'am.
when they had COVID?
Yes, ma'am. And a lot of times our patients at the thing like to call that the Trump treatment, because we all know that that's what he got when he went to the hospital. So a lot of our patients that are clinical say, well, I got the monoclonal antibodies like the president did. And the answer is yes, you can still receive the vaccine. However, they want you to wait for at least 3 months, 90 days, after you've had the monoclonal antibodies. And there's 2 reasons for that. One is because you're already protected. Having the monoclonal antibodies should, and the fact that you had COVID, you should have built some immunity on your own to have protected you for 90 days. The second reason is because of the limited, the vaccine could be inactivated by the antibodies. So just keep that in mind. It could stop the vaccine from working. So I tell everybody, you don't want it right now. You want to wait 90 days before you get it.
Okay.
The last part about it, that is the limited vaccine supply. You don't want to go through limited vaccine on people who are already protected. So.
Okay, got you. Karen, let's come back to you.
Ma'am.
Should I delay my mammogram when receiving the vaccine?
Okay, so after you receive a dose of any vaccine, part of the normal immune response might be swelling of lymph nodes. And we usually see it in the swelling of a cluster of lymph nodes under the armpit. And it is possible for the mammogram test to detect that inflammation and send up an unnecessary red flag. So if you do have an appointment for your annual preventative screening mammogram, then we do recommend that you notify your healthcare provider and let them know that you're also scheduled for the COVID vaccine, and they may want to delay your mammogram for 4 to 6 weeks. If you are getting a mammogram for diagnostic reasons, you know, it's part of a workup for some concerning finding, then we don't want you to delay your mammogram. So go ahead and get the mammogram, but make sure that the technician and the healthcare provider know that you received vaccine in the previous 6 weeks.
Thank you. Dr. Jones, Dr. Babcock talked about an EUA. First, tell us what EUA means, and how did they get the EUA so fast?
So, yeah, we're talking about the EUA. So EUA is the Emergency Use Authorization. So like I said earlier, this authorization came into law in 2004, and that law was in the Project BioShield Act of 2004 under President Bush. And, you know, it's good that we have the emergency use authorization for cases just like this. Now, what's really nice about it is that in 2013, it was reestablished under the Pandemic and All Hazards Preparedness Reauthorization Act under President Obama. And so what that did was gave new authorities to the FDA in order to enhance that preparedness and give a little bit of flexibility to those scientists. Now, just to be clear, EUA is not a part of that traditional development pathway that I talked about earlier for the FDA. It's a separate process, but it's only used in cases of emergencies like we have right now. And the FDA can issue an emergency use authorization in advance of any kind of emergencies that are out there. And this is really critical to the process of getting a treatment out to the public. I do want to mention that, you know, we're in the midst of this pandemic, and of course everybody is looking at what's happening with the FDA and the emergency use, but the EAU was actually, you know, authorized back in 2014 for 3 different in vitro tests for, we may remember the bird flu. So the EUA was authorized for diagnostics then, and also for the MERS-CoV. And so we're happy to have that, and I'm glad we have it in the EUA for cases just like this.
Thank you, Dr. Jones. Let's come back to CK for a minute. What has caused you to be worried or to be less worried since the vaccine has been on the market?
I am so glad you asked that. I love that Mayor Williams started out by talking how hesitant everybody was, and our councilwoman, I mean, everybody's talked about how hesitant they were. We've all been hesitant. And let's be honest, I wasn't sure I wanted a vaccine when it started until I really started looking into those clinical trials and those 30,000 people. I mean, 30,000 people is a lot in a trial. We've had wonderful trials. I'm also going to be honest with you, we have had so much fear-mongering and lies and myths being told. We've had it told from political people. We've had it told from all kinds of angles. And there's so many lies that are out there that we've got to do a better job getting to the truth. And the truth is, we got these 30,000 people that have taken this vaccine, and they're doing well, and they're not dying from the virus. As Dr. Orwig said, they're not dying. I mean, that's what we want, right? We want people to live. we also know that VSafe, I mean, it's been fantastic at providing information. It really has. And I encourage you to check it out if you don't believe me. It's just awesome what it's doing. As of right now, I told you it was a small percentage of the population. It's about 71 million people have received one dose in the United States, and what was it? 38 million have received both. 38 million have received both doses of the vaccine. 38 million is a whole lot of people to test in a trial, guys. I mean that. It's really a lot of people. I do like to say that they are showing extremely good safety, but I will be completely honest. Unlike Mayor Williams, I had a little bit of trouble with the vaccine. The first one gave me a very sore arm. My wife screamed and yelled the first night she tried to go to sleep. She had to sleep on her other side. I don't lie about that. And it made it so I couldn't raise mine past here the next day. But again, it was for one day. After a couple of days, all the soreness was gone. I felt normal. The second dose, I don't lie about that either. I was going to push through that and not have any adverse events. That's all I wanted to sail through that one and tell everybody there's no problems. I felt off all day. I wasn't quite right. I knew there was something wrong, but I was good, and I still pushed through it. And then I went to go home, and I made the stupidest mistake I've made for a long time. I stopped to get gas, and I did not put my jacket on, and it was about 15 degrees. On a normal day, I don't care. I'm dying in a jacket and a tie, guys. I'm hot as can be. But on a normal day, I'd have on a short sleeve polo. But in all honesty, I do that in cold weather all the time. I stopped that night and I got cold, and I went home and I sat down on the couch beside my wife, and she was on the other end of the couch, and she looked at me and she said, "You have to get into bed because you are shivering and shaking this whole couch, and I'm not putting up with that." So I had to go get into bed, turn on the electric blanket, put about 4 blankets over me, in about an hour, my chills were gone. I still didn't feel great. I felt a little bit off, but I woke up the next morning, I felt like $1 million. So one evening, if it's a little bit of chills, is well worth it to me to protect my friends, my family, everybody that I serve every day, and to be able to talk to people about vaccines and to be able to give them on a daily basis. So I think it's well worth it. Even the people I've talked to who've had problems for 2 days, they tell me I'd do it again in a heartbeat. And I think that's the most important thing to me is everybody said, I want my family protected. I want to hug my mama. I want to hug my kids, my grandkids. I want to be part of life again. And when we get to that 70% of those vaccines and that herd immunity, we're going to be part of life again. We're going to feel much better about it. I believe that.
We're going to be great.
Thank you.
Come back to Tyler for a minute. Tyler, this question doesn't pertain to me, but is it safe for me to get a COVID vaccine if I'm trying to become pregnant?
It's a great question, and a question we actually hear a lot. But to answer that question, I want to break it down into 3 different groups. The first category is women who are trying to become pregnant. Within that, I want to say yes, please, go get your vaccine. We know that once a female becomes pregnant, she actually becomes much higher risk of having adverse events or becoming a long hauler if she does contract COVID-19. So the best way she can protect herself as well as her child is to become vaccinated prior to trying to get or becoming pregnant. The next category is women who are currently pregnant. When we look at this, we actually have a statement from the American Academy of Gynecology and Obstetrics, and they say that we should not be withholding the vaccine from women who are currently pregnant. So although there were no females that were pregnant that were enrolled in the original clinical trials, we do have approximately 20,000 females that have either became pregnant or were pregnant and didn't know it yet and received the COVID-19 vaccine. The CDC is following these individuals, and to date, they have seen no difference in rates of premature birth, rates of miscarriage, and rates of stillbirth from the general population. So from this data, we currently are making a statement that it is safe, and we are encouraging those women to make that decision for the safety of themselves as well as their families. The third category we want to look at is women who are breastfeeding. And again, we want to encourage them that the vaccine is safe. Also, the vaccine can potentially confer some immunity to the child. We know from other diseases that women pass antibodies to their child through the process of breastfeeding. And we anticipate that that process is going to be the same through COVID. So for all 3 of these groups, women who are trying to become pregnant, women who are pregnant, and women who are currently breastfeeding, we would encourage you all to receive the vaccine.
Okay. Let's come back to Dr. Babcock for a minute.
Yes, ma'am.
Why do we need 2 doses of Moderna and Pfizer vaccine and only 1 of Johnson & Johnson?
That is a great question. And without lying to you, the best answer I can give you is the science tells us you need 2. Okay, we know for a fact all the clinical trials that they did showed 2 doses. We are getting some very small studies that are coming out that are looking at what 1 dose does. They are very small studies. They are not 30,000 people. 30,000 people is convincing. 100 people is really not. I'm not going to lie to you. So don't get excited. Don't get too excited yet. There are other places that are doing lesser doses, or they're doing 1 dose, and they can do what they want to do. We're following the science, and the science says 2 doses, and I really encourage you to get the 2 doses of the vaccines that are required to. J&J is a 1 dose vaccine, and there are a lot of people that are holding off waiting to get that 1 dose. I'm also hearing, correct me if you guys have heard anything different, but I'm hearing the adverse events from J&J are mostly a runny nose, which makes sense because it's based in that adenovirus, which gives you the common cold. So you get a lot of runny nose along with the arm problems like you always get. So those are the problems I'm hearing from it, and it's really very well received at every clinic that it's being given at. I'll just put it that way.
And some people want to take 1 dose rather than 2, but
Yes, ma'am.
it's up to them. Cara, let's come back to you for a minute.
Okay.
Should I be worried about the long-term side effects?
Okay, so as you can imagine, I've probably heard from nearly all of my friends about COVID vaccine in the last several months with questions. And I had more than one friend say, you know, I don't want to be calling the lawyer commercial in a few years because of the long-term side effects that no one expected. So ease my mind. And so I think it's important to realize that there are some very important differences between the medications that we see in those commercials and vaccines. Okay, so the first thing is that exposure. Okay, the medications that we see in these commercials with the unexpected long-term side effects are usually medications that people are taking every day for a really long period of time. So a lot of medication building up in the system and a lot of time to wreak long-term havoc. The vaccines, however, are very different. So the way I explained it to my 13-year-old daughter, you know, we are delivering an instruction manual to the immune system, but it's being delivered like a Snapchat, okay? The body breaks it down almost immediately, and the message disappears. So it's not hanging out in the body and doing damage, okay? So that's very different from the medications that we see in those commercials they're worried about, okay? Another thing is that even though these vaccines are fairly new, we have a long history of giving vaccines, and we've learned a lot from other vaccines. And one of the things that we know, CK kind of alluded to it a minute ago, is that if a side effect is going to happen after a dose of a vaccine, it's usually going to happen in the first few minutes, maybe hours, maybe days, but not after 60 days. And so 60 days is kind of that, you know, time frame that we use to define long-term side effects for vaccines. And in all of these clinical trials, the participants were monitored for 60 days after they received both of their doses, and there were no reported long-term side effects. So I hope those two things will ease your mind about the risk of long-term side effects because they ease mine.
Okay, we'll come back to Dr. Clay for a minute. Do I still need to wear a mask after I've been vaccinated?
That's a great question, and a question I've answered quite a few times. And the answer to that question is changing quite rapidly. So at this time, the answer to that question really depends on what setting you're talking about. So if you have received a vaccine, but you're going out in public, so you're going grocery shopping, you're going to Walmart, absolutely, we would still encourage you to wear a vaccine or wear a mask. We know at this time that approximately 13% of the state of West Virginia has received both doses of their vaccine, and about 24% of the state has received their first dose. That's a lot of unvaccinated individuals, and at this time, we don't know whether individuals who are vaccinated can confer that virus to others, even though that they're not sick themselves. So we would encourage individuals to still wear masks when they're going out in public. However, Dr. Orwig alluded earlier that the answer is not necessarily the same when we look at small group gatherings. If you have a small gathering and everyone at that gathering has been vaccinated, the CDC does say it's safe to not wear a mask, to not social distance. That same thing applies to individuals who have been vaccinated when they're visiting with individuals of a single household. who are unvaccinated as long as they are low risk.
All right. Karen, let's come back to you for a minute. Let's come back to the Johnson & Johnson.
Okay.
We've heard that Johnson & Johnson vaccine is less effective than the others. Should I wait for one of the others?
Okay, so the short answer is the best vaccine is the one that's available for you today, okay? Are these vaccines identical? No, they're different, but none of them are better than the other. They are all amazing feats of technological advances, Herculean efforts from scientists around the world. I mean, really, the intellectual capital that has gone into the development of these products has been amazing worldwide. And so they're all winners. One of the most important things I think to keep in mind is that all of these clinical trials for these different vaccines took place at different periods of time on the calendar. And so the pandemic was different. Think about how the pandemic has changed over the last year. So some of these trials took place when there were different circulating variants, some of these trials took place when there was low activity in communities versus high levels of activity. And so, sorry, I keep forgetting that. So we cannot compare the results directly. If you have an appointment and you don't know which vaccine you're going to get, you should have confidence that any of the vaccines are going to do what we want them to do. They are going to decrease your risk of hospitalization, and they're going to decrease the risk of death associated with COVID. And that's why we get them.
That's what we want. Let's come back to you again, Dr. Jones. And I had not heard of this, so you're going to have to tell me. What does the vaccine have MRC-5 in it? And what is MRC-5?
So MRC-5 is an abbreviation for Medical Research Council cell strain 5. And the answer is no, it does not. None of the vaccines have that in it. And I told you on the outset that my area of expertise is pharmaceutics, so I do formulations in various dosage forms. And thinking about formulations, as soon as these vaccines were given the emergency use authorization, I went straight to the FDA's website. I'm there all the time anyways, pulling down this information because I want to go straight to the formulations. And if you think of formulations like ingredients to bake a cake, right? And so you need specific ingredients to bake the cake in order for the cake to rise at a certain temperature and for it to taste good. And every ingredient has its purpose. Same thing can be said in our vaccines that has the emergency use authorization in this country. Any and everyone in America that has access to the internet can go to the FDA's website, pull down the letter that the FDA has given to the companies that has these emergency use authorizations, and those ingredients are listed there for each and every person to see what's in it. And so bottom line, no. And the second thing I would like to say is that it's funny that this question actually came up because this particular thing, I'm going to call it a thing, would not be used as an ingredient in any dosage form anyway.
Okay. So if somebody's talking about MRC-5, it's not relevant to us.
Dr. Jones, is that even legal in the United States? Is it used in the U.S. at all?
So there.
We don't want to go there.
I'm about to say this.
We're not going to go there. Okay. We are having. We have a note that the audience members are having difficulty hearing people respond. So I'm going to ask you to get close to your mic when you respond.
Okay.
Can you hear me now? Next question goes to CK. Is the COVID vaccine safe if I've had a reaction to other vaccines in the past?
So that's another great question. You're loaded. You're loaded tonight. I'm
I didn't
impressed.
come up with these questions.
You did
I
good.
just read them.
So, is it safe if you had a reaction to another vaccine? Well, that's a really good question. And the truth is, Europe has said don't give it if you've had any reaction to any vaccine. But the U.S. has gone a different way. We've told people to stick around and wait for 30 minutes. We ask them to wait for 30 minutes to be observed a little longer and to make sure that they're going to do okay. The truth is, most people who've had allergic reactions to other vaccines are not having that problem with this.
Wonderful.
But it is possible. So I like to say that.
Sure.
And I always like to say, how much more dangerous is it? We don't know yet. As we said, we're still gathering data, but for most people, it's safe. But we do always urge people to talk to their doctors and make sure that they feel comfortable with them getting it.
Okay. All right. We'll come back to Cara. Should I get vaccinated if I've already had COVID?
Yes, absolutely, yes. We want you to get the vaccine if you have already had COVID. So if you develop immunity from actually having an infection, that's called natural immunity. Because SARS-CoV-2, the virus that causes COVID, is so new, there's still a lot that we don't know about natural immunity. We don't know how long it's going to last, and we don't know how strong it's going to stay. So the protection offered by the vaccine is probably going to last longer and is probably more consistent. The clinical trials did enroll people who had previously been diagnosed with COVID, and there were no safety concerns whatsoever in the clinical trials. Anecdotally, my experience in the clinic, we are seeing a little bit of a difference in the side effects. Among people who have previously had COVID, they usually have those side effects after the first dose, whereas the people who haven't had COVID before their vaccination generally see the side effects more after the second dose. But it is safe, and it is highly encouraged that you go ahead and get vaccinated because we only know that you are safe for 90 days after having an actual COVID infection.
Okay. Thank you. And Tyler, I see Brian sitting in the back, and he's not busy, so if you have a question, please call 304-962-8138. Chief Rader?
Yes. Could you tell us how long you should wait after having COVID before you get the vaccine?
Is that another question?
Go ahead.
Okay, sure, I will absolutely answer that question. Yes.
Can you please state the question so that
Yes. Yes, so we had a question from within the room asking how long to wait to get the vaccine after you have had COVID. And there really are two schools of thought on this. Absolutely, you should not get it, the vaccine if it's been 14 days since your positive test, because you should still be quarantining, and we don't want you to go into a vaccine center around a ton of other people and expose them to COVID. And you should not have a fever when you get the vaccine. Now, because we think you do have that natural immunity for 90 days, it is safe to wait 90 days, but you don't have to wait 90 days. I don't know, CK might be able to answer this better. We have heard from some people that their employers were forcing them to wait 90 days just because they wanted to go ahead and give vaccine while it was available to other people who didn't have any natural immunity at all. But I'm pretty sure most of the vaccine centers in our area are allowing people to go ahead and get vaccinated as long as they're out of quarantine.
Or isolation, either way. And the CDC actually changed their stance. You know, it was 90 days previously, but now that vaccines become more and more available, they've said the moment you're out of quarantine or isolation and you feel good enough to go out in public, yes, please get the vaccine. So, yeah, that's exactly. You know, I always like to say that, you know, even people that get the vaccine on occasion do get COVID. Remember, we mentioned the efficacy rate is not 100%, and I had a very interesting discussion with a good friend of mine who works at a school up north who said he does contact tracing. That's what he does. And he had 3 people yesterday who had the vaccine pop positive on COVID tests. So remember, the vaccine is not a guarantee. It's not a guarantee. However, none of those people were sick enough to get hospitalized. Proud to say that. All of them just had a runny nose, didn't feel good. I'll take that any day of the week. They were also all students at the school, but they were all young people. So, But again, like I said, yeah, you can take it as soon as out of isolation or quarantine, either way.
Let's come back to Tyler for a minute. If I have minimal side effects, does this mean the vaccine wasn't effective?
I drew the easy questions tonight. So, we talked a lot about these clinical trials over the course of the evening in a lot of different contexts. And all of us within this room have probably spent 100 hours reading through the data from these clinical trials. But when you step back and you look to answer this question in the context of the clinical trials, the answer is you're fine. These trials, we've said again, have had more than 30,000 individuals enrolled in them. And when we look at the data from those trials, almost half of them, or 15,000 of those individuals, did not have any side effects from their COVID vaccine. However, the data from within those individuals that had no side effects was exactly the same as those who did have side effects from the vaccine. So to answer your question, if you had no side effects from the COVID vaccine, you were still protected the same as someone who did.
Okay. Cara, we're going to come back to you. Should I stop my immunotherapy and or chronic steroids to get the vaccine?
Okay, so the person asking this question is concerned about medications that may weaken the immune system. And when we talk about this patient group, for people who are taking these types of medications, it's not a matter of is it safe to get the vaccine, but whether or not it will be effective if they have a weakened immune response. And these patient groups were not included in the original clinical trials, so we don't know how effective they're going to be. But expert groups do recommend that you proceed with vaccination because some protection is better than no protection. Okay? There are some caveats depending on the type of immunosuppressant medication that you are receiving. So people who are undergoing stem cell transplants or CAR-T therapy should wait 3 months to get their COVID vaccine. Patients who are receiving intensive chemotherapy that drops their white blood cell count, we want to wait until your white blood cell count recovers. And most people who are on these types of medications are pretty, well aware of when their white blood cell count is low, and probably also aware that they need to go on antibiotics anytime they have a fever. So if you develop a fever as a side effect of the vaccine while your white blood cell count is low, it can kind of muddy those waters. So we'd rather you wait until your white blood cell count has recovered. For patients who are on immunotherapy or radiation therapy, you can proceed with vaccination with no interruptions to your other treatments. And then the steroid piece is, it probably depends on how high the dose is and how long the patient has been taking it. If you can safely stop your steroids for 2 weeks before vaccination, that's probably a reasonable approach, but you need to discuss that with your healthcare provider first. Don't just do it on your own. If you all decide that it's not safe to stop those steroids, then we still want you to proceed with vaccination even though you're still taking the steroids, because the risk of developing severe COVID illness is much higher than any concerns we would have about it maybe not being as effective.
Okay. We're going to come back to you, Tyler. Is it safe to get other vaccines at the same time as the COVID vaccine?
That's a great question, and it's come up quite a bit because as we were all locked down and quarantining and doing those things over the last year, a lot of individuals may have fallen behind on their routine vaccinations, hepatitis A, hepatitis B, their Tdap. So the current recommendation from the CDC is that if at all possible, you want to avoid any other vaccines 14 days before or 14 days after a COVID vaccine. So when you think of that in the context of the Moderna vaccine or the Pfizer, you would want to wait 14 days before and after the first dose, as well as 14 days before and after the second dose. There is a caveat to that, though. So let's say you are newly employed at a hospital. You're a new graduating nurse, and you're eager to join the workforce. Some of those hospitals may require you to do some titer testing to make sure that you're adequately protected to things such as hepatitis A and hepatitis B. If for some reason your titers are low and you need boosters of those shots, we do encourage you to receive those before the COVID vaccine and then proceed with the COVID vaccine and wait 14 days after before you receive any other sort of immunizations.
Cara, next question is for you. Can those who have been vaccinated still be carriers of the virus and spread it to others?
The answer is that we don't know yet, but we are getting more and more information every day. So the original clinical trials were designed so that they only identified people who had symptoms of COVID, who required hospitalization for COVID, or who died from COVID. And so it wasn't designed to identify those patients who are infected but don't have symptoms. And that's a really critical piece of information that we need if we're going to decide if the COVID vaccines are effective in preventing spread, because hopefully one thing we've learned over the last year is that asymptomatic people can spread virus to other people, right? So that is the piece that we needed. There are some ongoing trials right now, and there's kind of been a steady stream of preliminary results that have been leaking out over the last week or so, and they look very promising, which is magnificent news. It appears that the vaccines probably do prevent all types of infection, including asymptomatic infection, which is, the news that we want to hear, but that has not been peer-reviewed, so we're waiting on validation, and in the meantime, we need to continue wearing masks in public and around those people who don't live in our household who haven't been vaccinated.
All right. Dr. Jones, is there a possibility of a latrogenic reaction? I don't know what that means either.
I get all the technical things. Okay, so I believe this question is centered around the iatrogenic reactions. And so what that is essentially are outcomes that are inadvertently induced by medical treatment or diagnostic procedures, perhaps a physician or a surgeon. So the answer to that is yes, it's a possibility, but there's some risk factors that will make one person more susceptible than the others. And some of those things are like people that have multiple chronic diseases. So if you have multiple chronic diseases, this means that you're at a greater risk of a treatment for one disease is going to worsen the other disease. The other thing is if you have multiple chronic diseases, you probably have multiple physicians. And so in the treatment for these diseases, there could be some uncoordinated care, which then leads to polypharmacy. And so with polypharmacy, this means that you're taking all of these medications that's given to you by maybe your cardiologist and then maybe a rheumatologist, and you have all these things going on, but there's a reaction or negative response to taking all those medications. But here's the good news, because I like good news. I love good news. There's ways that this can, there's interventions to this. First of all, you can probably look at care management. If you have care management, then those managers can coordinate that communication between all of your physicians. The other thing you can probably have, which is really, really helpful, is talk to your pharmacist. We have pharmacists that are everywhere. They can help you look at the medications that were prescribed to you, and they are the experts. They will know if there are any issues with you taking multiple medications. So that's all you need to do. But yes, it's possible, but there's a way to intervene in that possibility.
And I think the important thing that you said was that it is important to talk to the pharmacist.
Absolutely.
I remember getting my prescription changed once, and I'm at the pharmacy, and the guy says, if you take this, you'll probably die. Okay, no, I don't want that. But there was a disconnect between my doctor looking at my record and what he prescribed for me, and the pharmacist caught it before, and I'm still sitting here. It's good. Dr. Babcock, let's come back to you.
Yes, ma'am.
The question says, I contracted COVID after my first dose of the vaccine. Do I need to wait to get the second?
I think we've done a good job talking about this. You don't need to wait. You need to get that second dose as soon as you're out of isolation.
Okay.
And I think that covers it. I think we did a great job. Dr. Orwig did a great job talking about that earlier.
Wonderful.
The other thing I would add is, again, this is, again, why we need herd immunity. We really need to make sure we keep that herd immunity up, and it cuts everybody's chances of getting it.
Okay. Dr. Orwig, let's come back to you. Should people who have allergies still get the vaccine?
Okay, yeah, I think we've touched on this a couple times before too, but the only people who cannot receive the COVID vaccine are people who develop an immediate allergic reaction after the first dose of the Pfizer or Moderna vaccine. They shouldn't go ahead and get the second dose. But we've already talked about how we've got safety measures in place for those people who have history of allergies to other things. One other thing I did really want to quickly touch on is that anaphylaxis and severe allergic reactions have occurred very rarely. At most, the rate of anaphylaxis is 1 out of 100,000 people, and compare those odds to the odds of dying from symptomatic COVID, which is 1 in 59. Okay, so receiving the vaccine is extraordinarily safer than developing symptomatic COVID.
Okay. So those are all the questions we had for the panel. So we'll move to the questions that came from the folks who called in. And there are a couple. So Cara, since you're already talking, we'll start with you. Some individuals experience some mild symptoms after the first dose, but mostly the second dose. Please discuss the use of either Tylenol or other possible agents to treat these mild symptoms.
Okay, what I generally recommend to people is not to take any medication like Tylenol or ibuprofen before the symptoms start. So if you take it too early, then you may theoretically affect the immune response. So you don't want to take it before because you're expecting to have side effects. Plus, in some of these people, for my own personal experience, after the second dose, my symptoms did not start until 14 hours after my dose. So I would have been taking Tylenol all day to try to keep up when I wasn't even having any of those symptoms. So I don't think there's any problem with taking Tylenol or ibuprofen once those symptoms develop, but don't do it before you get the vaccine just because you're expecting to get them.
Okay. Tyler, next question is for you. I have had chronic ITP for 30 plus years. My fear is that it could worsen my symptoms. What should I do?
Okay, so
First of all, what is ITP?
that's a great question. So I'm going to assume that this caller is talking about idiopathic thrombocytopenia. So what that really refers to is they have low platelets, and they're concerned because there have been some rare cases or case reports from the vaccine of individuals having bleeding events related to it. However, the short answer I would say is an individual that has ITP is most likely following with a hematologist, and I would recommend that they have a one-on-one discussion with that hematologist about their personal risks. There is a whole spectrum of ITP from patients who have dangerously low platelets up to almost normal platelets but slightly low, and depending on where you're at in that spectrum could change the answer to that question. So this really comes back to it's going to be a personal decision and a personal conversation with your hematologist.
Okay, we're going to come to our last question here, and that's for you, CK. Oh, here comes Brian with another question.
Hot off the
Coming
press.
back. He's not leaving.
But while Tyler looks at that, CK, is it safe to get the vaccine if you are having a flare-up of your COPD and struggling to breathe?
Great question about the COPD and the flare-up, and I love this question because first off, if you're going to be hospitalized, please don't get a vaccine. I don't care what vaccine it is. Please avoid the vaccine. I don't want it blamed for anything. If you're going to be hospitalized, let the hospital take care of you. If you need to be that much treated, you need to go in and get that treatment. When you feel better and you can be discharged and you feel good enough to be home and to be normal, then get vaccinated. And that's what I tell everybody. Flare-ups of COPD. The one thing I do want to say, and I love Dr. Orwig's comment about steroids earlier and being able to stop them. I do want to comment that she was talking about oral steroids for arthritis and diseases like that. She was not talking about inhaled steroids for asthma or COPD. We want you guys to continue those. You do not have to stop those. You can take those the whole time you take the vaccine. But if you are having a COPD flare-up, you probably need to get in to be seen. And if you're having a severe one, you sure don't want to get a vaccine because some of the side effects could make you feel like you were worse. And let's not do that.
CK, the next question is, it's my experience that many of the providers are not informing candidates about registering with VAMS, V-A-M-S. How vital is it to sign up?
So VAMS is not a problem. Anybody who provides the clinic can sign you into VAMS. So that is not a problem. The V-Safe that I was talking about, that is a problem. We need people signing up in V-Safe so we can collect that data about safety for them and help them too. The other thing I would say, the VAMS, there are some people that let their people sign up early. And if they ask you to do that, please do it. But most of the time, you can just go to the clinic and they'll sign you up as it is.
Okay, all right. Which brings us to the last point, Dr. Babcock. If anybody wants to sign up to get the COVID vaccine.
My favorite question. Thank you for asking. First thing I want to say about the Fairfield community is our school pharmacy moved there just not too long ago. I love the place. I walk out back in the houses all the time. We are right beside the A.D. Lewis Center, and I apologize to you because I did not know where it was. Today was the first day I ever walked over there. I talked to Maria Hill yesterday, called her on the phone, and she said, and I confirmed with the health department, we are providing vaccines at the A.D. Lewis Center every Tuesday from 9 to 1. If you want a vaccine in the Fairfield community, please call the A.D. Lewis Center at 304-696-5908. Again, 304-696-5908. They really prefer appointments, but they will take walk-ins, okay? So if you can't make an appointment, you can walk in on Tuesday between 9 and 1. Love to have you. And I want you guys to know these things change all the time. But the health department told me, they said, we're sending 100 vaccines there every Tuesday. And we would love to send more. So if we get people over there and we get 200 people show up, we'd love to send them 100 doses that day, and we will. So, our health department is really excited to expand all the opportunities to be vaccinated to everybody who wants a vaccine. They're very excited to put it out there. They're doing a great job in our community. They're wonderful people. They also, the roles are changing every day. And that's, last week, you had to do all kinds of things in order to get the vaccine. This week, I'm probably not supposed to tell this, so you can do it by word of mouth, but don't write it down, okay? Don't write it down or put it on social media. But if you're 65 or older, you show up over at Barbersville at the Sears building, and guess what? They're going to take care of you. As long as they got vaccine, they're going to take care of you. And that's so 65 and older. If you're 65 and older, you've been waiting, please go see Sears tomorrow, or Tuesday through Friday. Again, they're not open. They're not open on Mondays, and they usually start about 8:30 and they go to about 3 o'clock. So please show up in that time frame.
Also free transportation.
Free transportation from TPA. Come on, man, that's wonderful. That's fantastic. Free transportation from TPA to there. The last thing I would say is, last week you were supposed to get on the state system and get signed up. This week they changed it. They said if you can't get a vaccine and you want one, call the health department. We have 10 people making appointments every day. So if you can't get into that A.D. Lewis Center at that time, call the health department at 304-526-3383. They've got 10 people making appointments all day long. We would love to vaccinate you. If you are interested, we'd love to vaccinate you. If you still have questions, stop by the school of pharmacy. If Jones or Clay or I are there, I guarantee you we'll talk to you. We would love to have conversations with people to help you guys get vaccinated.
And can I add that if you are on a list and then you go and get the vaccine, make sure that you call whoever put you on the list, tell them that you've gotten the vaccine so they can put somebody else in that slot.
That would be wonderful. Thank you.
Mayor?
Let me just thank you. And I'm going to just state the obvious. Those of us who live in Huntington are so lucky that we have you. It just absolutely amazes me the level of intellect, knowledge, and training that you all have taken upon yourselves in your lives. Clearly, what has driven you to this passion is that you love what you do and you're wanting to help people. So thank you so very much. You have enlightened us beyond measure. Let me confess something. And I imagine there's some folks that might identify with this. As I indicated to you, back in the summer and the fall, I was somewhat reluctant and wondering, do I really want to do this? That was a sign of something that I have never really had reason to admit publicly. I'm afraid of the dark. Terribly afraid of the dark. I don't want to walk into a dark room. Give me a chance to even light a candle. And if I can see what's in there, then my anxiousness starts to dissipate. I sleep with the light on in another room.
I do too.
Don't like being in the dark. What you all have done today is you have brought floodlights into our city. Anybody who's been listening to this, and will continue to listen to it as it is being replayed. There are floodlights here. I know that if I'm about to go into a room, just give me even the chance just to flick the light on and off just so I can see. You all have brought the floodlights. And for those who have been feeling uncomfortable, I know that you have comforted them tonight, but you've also pointed out a couple of things. Talk to your doctor. Talk to your pharmacist. It's the one thing that I've learned from Kevin Yingling and Brian Gallagher and others. You can go talk to your pharmacist and they can make sure. Here in this town, there are others who are like you, who are able to provide that similar advice. We are so blessed. Thank you so very much. This has been enlightening for me, and thank you for bringing the light into our lives. Thanks.
Thank you, Mr. Mayor. I want to thank our panelists for all of that great wisdom you imparted to us. Thank you, Mayor Williams. Thank you, Councilwoman Johnson. Thank you to our sponsors. And I want to thank Brian Chambers, who's been manning the phones for us. And if you have any more questions concerning the vaccine or COVID, please call the health department. They can answer your questions. It's been my pleasure being your moderator. Have a good evening.